Come in.
I'm going to wash my hands when I enter the patient's room. Hey, Mr. Piatek, how are you doing today?
Good, how are you?
I'm good, thank you. My name's Liz. I'm a student nurse from Harper College, and I'm going to be doing an assessment of your thorax and your lungs today. Would that be all right?
Mm-hmm.
Okay, so I'm going to start off with a few questions. Do you currently use cigarettes or any tobacco products?
No.
Okay, and then have you ever in your lifetime?
No.
Okay, and then another question for you. Do you have any history of any respiratory illnesses such as asthma, bronchitis, emphysema, anything like that?
No.
Okay, good. So we're going to start with the inspection portion of the assessment. So just by looking at him, I can see that his respiratory rate is within normal limits. There's no acute distress noted. I can see his breathing pattern is non-labored. I see that he has no use of any accessory muscles, no nasal flaring. There's also no bulging or retraction of the intercostal spaces. I can see that he's sitting up erectly. There's no postural changes to support his breathing. By looking at his skin, I can see that his skin is appropriate for him. There's no signs of cyanosis or pallor. I can see that his anterior chest wall is symmetrical just by looking, and that his, lift up your arm, that his AP ratio to his transverse ratio is 1 to 2, so that's also within normal limits. Okay, so I'm going to do the palpitation part of this assessment, so I'm just going to touch and feel around your chest wall. If you have any pain or tenderness, you just let me know, okay?
Okay.
Okay. So start up here and work our way down, feeling for any pain, tenderness, lumps, masses, bruising, anything like that. You don't feel any pain?
No.
Okay. And I don't feel any lumps or masses. And I'm going to have you stand up and turn around, and we're going to check his posterior chest wall symmetry. Okay, so could you take one big breath in and release, please? Okay, so the chest rose and fell symmetrically. Sit down, please. Okay, and now we're going to auscultate the lung sounds. I'm going to ask you to breathe through your mouth and a little deeper than you normally would, okay?
Mm-hmm.
So we're going to start with the trachea, and then we're going to do the anterior part of the chest wall. Okay? Through your mouth. Okay, good. And then we're going to do the right side. Okay. And there's 3 lobes on the right side, so we're going to do the right upper lobe, middle, and lower. Okay, and then we're going to go into the left side. There's 2 lobes on the left. This way. Okay. Okay. Okay, and then can you turn around for me, please? And now we're going to do the posterior part of the thoracic cavity. So we'll start at the apex of the lung above the clavicle. Do you feel dizzy at all?
No.
Okay, I'm finished with that. So over the trachea, I heard bronchial breath sounds. On the anterior side of the chest wall near the sternum by the first and second intercostal spaces, I heard bronchovascular breath sounds. Also posteriorly by between T10 and T6, I also heard bronchial breath sound. And then throughout the rest of the anterior, lateral, and posterior part of the thoracic cavity, the peripheral area, I heard vesicular breath sounds. And that will conclude the lungs and thorax assessment.